Hello, my name's John Ford and I'm an academic public health doctor at Queen Mary University of London and director of the Health Equity Evidence Centre. Our pioneering research is making it easier for the NHS to address inequalities in the provision of primary care. General practice is under considerable pressure. There's a substantial mismatch between patient demand and supply of services. The situation is compounded by a workforce crisis, with the number of fully qualified GPs decreasing. This has led to patient satisfaction in GP services being at an all-time low. In 2021, 83% of patients rated general practice as good or very good. This has dropped to 71% in 2023. We know that the challenges faced by general practice are not spread evenly across the country. People living in more affluent areas have more GPs per head of population, more funding from the NHS, and better patient satisfaction compared to their poorer counterparts. Inequalities in primary care contribute to the £4.8 billion of NHS funding lost every year and the 185 million working days lost each year because of sickness or injury. We've known about these inequalities for years. What we've lacked is evidence-based solutions of what to do about it. We've trained a machine learning algorithm to identify research which shows what works to address inequalities in primary care. In a world first, we've created living evidence maps which shows this evidence. Machine learning software means that we can screen through over 250 million research studies to find the most relevant for the NHS. This process would have taken researchers months, but we can do it in a few hours. The efficiencies of machine learning software means that we can keep the evidence maps up to date continually. To help the NHS know what to do, we translate our evidence maps into short, accessible evidence briefs. We aim to tackle the complex system problems that the NHS decision makers struggle with, such as how to make self-referral more equitable, how to ensure equal access in practices that use digital triage, and how to avoid vulnerable patients falling between the cracks during referrals from GPs to hospitals. Our work has highlighted the importance of addressing the structural factors which drive differences in the provision of general practice. Fundamentally, policymakers need to reform the Carhill funding formula to make sure that it takes account of the additional resources needed by GPs to help vulnerable and disadvantaged patients. If the NHS is going to evolve to meet the demands of current and future generations, it needs to implement the most efficient and effective services. Our Evidence Centre is innovatively changing how the NHS navigates research studies by harnessing the benefits of machine learning to bridge the gap between research and practice.